Thank you for the European Business Summit for organizing this important gathering. Distinguished guests, ladies and gentlemen, I am a medical doctor by training, and I have always been proud of Europe's health systems. They are among the best in the world. Yet the challenge of this pandemic is unprecedented in modern times. We now know that defeating this virus is possible, but no country and no government can defeat this virus alone. This is true, first of all, at the global level, secondly, inside Europe, and thirdly, between the public and the private sectors. Let me focus first on our response to the pandemic. The European Union has taken the lead to convene a global response to COVID-19 and not only a national one. For this purpose, we not only work with WHO and the G20, but also with civil society and foundations and other private players. Our common goal is to finance the development of vaccines, tests and treatments for the whole world. We so far raised 16 billion euros. We also joined and contributed to the COVAX facility to ensure that newly developed vaccines are also available for low and middle income countries. Team Europe alone has provided 800 million euros, and this is the largest donation to COVAX worldwide. Why have we done that? Because we are convinced that we will only defeat the virus if we defeat it all around the world. Secondly, we have established an unprecedented cooperation inside Europe on health issues. In November, we have taken the first steps to establish a European Health Union. We will now have an EU-wide preparedness and response plan. This will help us harmonize national plans, including audits and stress tests by the European Commission. We want to make it possible to declare, if necessary, a state of EU health emergency. And this would trigger greater coordination among member states. It would trigger joint procurement of medical equipment and, for example, the deployment of EU outbreak assistance teams. To better support member states, we also propose to give more responsibilities, and thus powers and resources, to our existing European agencies. The European Centre for Disease Prevention and Control, ECDC, and the European Medicines Agency, EMA. To improve our forecast, we will create a new agency, the European Health Emergency Preparedness and Response Authority. It's a very long name. We call it HERA. HERA will focus on next crisis and, if possible, avert them. So HERA will work with all the relevant players, from conception to deployment of therapies, vaccines, and technologies. This kind of cooperation is essential to a rapid response in the event of a health emergency. Governments alone cannot end this pandemic, and that's why the Commission presented last week its pharmaceutical strategy. It is about creating win-win situations with the private sector. But we also want to put patients at the center of medicine's development and supply. And thus, we will be working with innovative small companies as well as large multinationals in Europe. Europe can take the lead in supplying groundbreaking medicines that are also affordable and widely available. These are three cornerstones of our new health policy, and we will continue to build the health union in the coming months with our Beating Cancer Plan and the European Health Data Space, together with global partners, together with all Europeans. And together with the private sector, only together will we be able to address the biggest challenges for global health. And this leads me to the last point. As one expert at Johns Hopkins put it, vaccines don't save lives. Vaccinations do. The development of vaccines has been a remarkable team effort. But we will need an even greater effort to deliver them to every village of this world. And we have to prove the safety and the efficacy of those vaccines, especially in the face of growing vaccine skepticism and disinformation campaigns. And the message is clear. Vaccination is about self-protection and solidarity. Dear guests of the European Health Summit, we have to build strong and trustworthy narratives. And this is possible because together we have made unprecedented progress in the area of vaccines, and this is the result of joint cooperation. I count on your further support. Thank you.